Braving icy winds, T. Nkrua journeys to a herder's home on the Mongolian steppe. She has come to look in on a patient, B. Inkjagal, who is 32 weeks pregnant. It is now time for Inkjagal to go to the district hospital, where she will stay until she gives birth. Nkrua assesses her patient's condition and decides Inkjagal is ready for travel. She enters the latest information into a PDA, which instantly updates the patient's medical records. The device also provides a comprehensive directory of local healthcare professionals. For nurses like Nkrua, who must visit families spread across hundreds of kilometers, new technology is helping bridge the distance between healthcare workers and their patients.
2 years ago, nurses were given computer training and a PDA which contained first aid instructions and information about the patients. This has made things much easier for us. Plus, we have all the contact information of the district doctors, including telephone numbers. So, in an emergency, we know now what to do and who to contact without losing time.
Supported by a grant from the Asian Development Bank, Mongolia has begun upgrading its healthcare system to provide an information lifeline to the country's most remote areas. Because of the geographical isolation of many communities, rural healthcare services are often underdeveloped, and healthcare professionals have limited access to up-to-date information. Mongolia is installing new computer systems, boosting internet access, and offering intensive technical training with the aim of improving access for poor mothers and children to quality health care.
Since the implementation of the project, we've had a clearer count of pregnant women and who is at risk, and doctors can keep track of the delivery plan. As a result of the program, we're able to bring at-risk pregnant women to the provincial hospital, so the mortality rate at delivery has decreased significantly.
The new IT infrastructure is also helping rural doctors care for medical problems beyond their expertise. At the National Health Agency in the capital, Ulaanbaatar, trauma doctor Hashku has been called in to consult on a case in Dornos province, some 500 kilometers away. By digital uplink, he inspects scans and x-rays of a 50-year-old patient suffering from a brain and spinal injury. He advises the local doctor on how to treat his patient.
Before the program, it took us 7 to 8 hours to reach a patient in Dornos province. We just now provided medical treatment to this patient within only 15 minutes.
The technology goes largely unnoticed by expecting mothers like Inkjagal. But it provides an invisible safeguard that helps ensure a healthy delivery for both new moms and their babies.
Asia is a vast, diverse and heterogeneous region, which accounts for 20% of the world's land area. It is home to half of the world's population. Its 49 economies are at widely different levels of economic development, embrace different economic philosophies, and have different political systems. Asia today is on the cusp of an historic transformation. If the region's successful economies can sustain their growth momentum, Asia could grow to over half of the global economy by 2050 from the current 27% of the global output. Per capita incomes in the region could multiply nearly 6-fold, making it an affluent region. Some 3 billion more Asians will enjoy the living standards of Europe today. There will be no poor country in the region. This prospect has given rise to the term, the Asian Century. Asia's growth would be driven by People's Republic of China, India, Indonesia, Japan, Republic of Korea, Malaysia and Thailand. The Asia 7 would account for over 85% of Asia's incremental GDP between 2010 and 2050. This will be a truly historic transformation, but it is by no means preordained. History tells us that Asia's growth will not follow a linear path. There will be crises. Asia will have to manage them while maintaining its focus on the longer term. There are also a number of mega challenges. Large and, in many cases, rising inequities within countries could undermine social cohesion. Weak institutions and complacency can drive the countries into the middle income trap, where countries stagnate at middle income levels. The anticipated rise in the living standards of some 3 billion additional Asians will create intense global competition for the Earth's finite natural resources. Climate change could threaten agricultural production, and rising sea levels would severely affect low-lying coastal areas. Both could affect billions of Asians. Cutting across all of these other challenges is the recent deterioration in governance in many countries. These mega challenges transcend generations and could even lead to national and regional conflicts. Meeting the mega challenges requires individual countries to implement a demanding and multi-generational agenda at the national level. Collective action by the countries as a region, as well as a more proactive role at the global level. Almost all Asian countries must give much greater priority to inclusion and elimination of inequities through significant investments in education, provision of quality infrastructure and financial inclusion. Addressing the gender dimension of inclusion will be critical. To keep its growth momentum, the region needs to harness the full potential of entrepreneurship and innovation to meet the needs and rising expectations of millions of people, particularly those at the bottom of the pyramid. To secure long-term competitiveness, Asia has to take global leadership in the efficient use of resources and develop radical energy efficiency and diversification programs. Transforming institutions and improving governance will be required to ensure social and political stability and retain the legitimacy of governments. Regional cooperation will be critical for enhancing trade, connectivity, and adequate provision of regional public goods such as maritime security and disaster preparedness. Asia must become a leading advocate of open global trade, a stable global financial system, peace and security, and aggressive action on climate change. Shortfalls in delivering on this agenda will deprive billions of Asians of the benefits that would accrue from realizing the Asian century. Asia's output in 2050 would reach less than half of its potential. Asia's share of the global economy would remain at 32% versus 51%. GDP per capita would be cut by half. Most importantly, billions of Asians will have to wait another generation or more to benefit from the promise of the Asian century. Which of the two scenarios becomes reality will depend on Asia's ability to maintain focus on the long-term vision and policies and foster cooperation in addressing the mega challenges. Asia's future is in its own hands.
In the remote village of Dandalapadia, in the eastern Indian state of Orissa, solar lanterns are transforming lives. The village has no electricity, and for centuries life stopped after sunset. For women like Nagiri Dangili, who collects leaves to turn into plates, having a solar lantern has meant many more productive hours in their day.
In 1 month, we're getting 300 rupees from salt plate stitching. That's more than the money we used to make.
For all of the villagers, solar lanterns have improved their lives. It used to be that when night fell, villagers retreated to their houses to wait for the sun. But now, evenings are busy.
We can work on our plate stitching, make traditional mattresses, and our kids can study. And when one is going out in the night, one can take the lantern to avoid the many snakes there are in this forest area.
The villagers bring their lanterns to Pavati Badia, a local entrepreneur, who turned her grocery store into a solar charging station. She uses solar panels to charge the nearly 60 village lanterns. The lanterns and charging cost just over $1 a month.
I'm getting much more respect now from the community due to the work I do. All the benefits are due to the light.
Since 2008, 160,000 people have benefited from the Lighting a Billion Lives project. Funded in part by ADB, the project is run by TERI, the Indian Energy and Resources Institute, in partnership with local NGOs.
We will be able to do south-south